Migraine is the most disabling neurological disorder that exists, with 15 to 18% of the global population affected. And with well over 1 billion people suffering, the current primary medical treatment leaves a lot to be desired. Right now, your mainstream options are medication, Botox, hormone replacement therapy, or nerve ablation surgery, where they, as a medical doctor I know once told me, cook the nerve that is giving you pain. There are many alternative options out there, like musculoskeletal work, nutritional shifts, and non-invasive hormonal regulation, but they don't all work for everyone. And similar to Botox and medication, you can become dependent on these alternative methods, which, in my opinion, is better than having to rely on meds and Botox, but it's still not ideal if our goal is living the best quality of life possible. Now, don't get me wrong. Every single one of these treatments is capable of helping you in big ways and might be absolutely necessary to manage your symptoms effectively. A team approach to migraine treatment almost certainly achieves the best outcomes, but there's one more option that you should know about. What if I told you that there was a way to rehabilitate your migraines so that you were less likely to experience them and make you less reliant on whatever treatment you're currently using to manage them? I'll be honest that we have a long way to go on the research side of things, but through my years of clinical work and hundreds of the most severe migraine cases seeing significant improvements, I think we're onto something. The concept of migraine rehabilitation makes a lot more sense if we first understand what a migraine really is. The underpinnings of migraines are incredibly complex, but I'm going to try to boil it down for you as simply as possible. First off, a migraine is not a headache. Migraine is a neurological disorder. It's also almost always genetic. We know that a migraine patient's brain, which I will refer to here on out as a migraine brain, is different. A migraine brain has more connections in some areas and less connections in other areas than a non-migraine brain. This imbalance, along with a slew of other factors, many of which we don't fully understand yet, causes some areas of a migraine brain to be way more sensitive than they should be. The amount of sensitivity in these areas can vary from day to day and from person to person. Migraine attacks occur when these dysfunctional brain regions are pushed beyond their limits and become too sensitive. So when you tell someone that you have a migraine, you are not saying that you have a headache. You're really saying that part of your brain is too sensitive right now, which is then causing a migraine-type headache, usually focused behind one or both of your eyes. But you might be surprised to know that there are people with migraine that don't experience any head pain at all. Some people experience vestibular migraine where they get dizzy. Some experience hemiplegic migraine where part of their face or body will go weak or numb. Oftentimes you can experience a combination of these symptoms. These conditions are all classified as migraine. They involve an area of the brain that becomes oversensitive to the point of giving you some sort of symptom. But how does a migraine brain become sensitive enough to bring on a migraine attack? This is easier to understand if I show you an analogy that I was taught by a mentor and friend of mine, Dr. Adam Harcourt. Imagine that the hypersensitive areas of your brain are a bucket. There are various triggers that are going to fill up your bucket. The first primary trigger is one that affects us all and can sometimes be impossible to get away from: emotional stress. Other primary triggers involved are musculoskeletal stress, nutritional stress, and hormonal stress. A migraine attack can occur when any combination of these triggers overflow your bucket. Migraine brains tend to have a much smaller bucket than non-migraine brains, so it might not take a whole lot of stress to overflow a migraine brain's bucket. Now that we understand the basics of what a migraine is, the theory behind migraine rehabilitation shouldn't be too hard to grasp. We have two main goals. First, we want to identify your triggers and eliminate them to the best of our ability. Note that different people are more sensitive to different triggers. This is why changing your diet helps some migraine patients, but not all. Myofascial work, chiropractic, hair, and acupuncture is more likely to help those with a bigger musculoskeletal trigger, but might not be as effective for someone with a bigger hormonal trigger. The second goal is to make the migraine brain's bucket bigger. By designing targeted exercises for you to practice, we aim to strengthen these hypersensitive areas of your brain so that they aren't quite as sensitive anymore. By making your bucket bigger, your triggers may not affect you as much, leading to less migraine days, less reliance on trigger management, and an overall improved quality of life. Now, I want to be clear that there is no cure for migraine. Migraine severity is a spectrum. People with very small buckets may experience migraines daily. Those with bigger buckets may have a migraine maybe once a year. Our objective throughout your care is to strengthen your brain, identify your triggers, and shift you as far as possible down the migraine spectrum. While not every migraine patient will respond to rehabilitation, it's always worth a try no matter how severe your condition is. Be sure to subscribe so you don't miss out on more videos that outline some of the most promising neurological exercises that I've seen help my migraine patients. If you have questions about how to build a team of practitioners to help you with your migraines, leave a comment below or reach out to me at virtualbrainrehab.com. And as always, if you learned something, please give this video a like. This is Dr. P. Thank you so much for watching, and I'll see you in the next video.